The American Diabetes Association has published a position statement which endorses a change in body mass index for Asian Americans to identify their risk for diabetes. If you are of this BMI, namely equal or greater than 23, it should trigger an action to talk to your healthcare provider about screening for diabetes. In the past, there's one standard which the ADA, the American Diabetes Association, would use to screen people, to identify people who are at risk for diabetes. And one of the criteria is if your body mass index is equal or greater than 25. I think the challenge has always been many clinicians find that many Asian Americans who develop diabetes actually have a body mass index of less than 25. The fact that they don't look overweight, the fact that many of them look like they are normal weight, in a way de-emphasizes their need to screen for diabetes. Just because you don't look very overweight does not mean that you're not at a higher risk for developing diabetes. And that's the message, I think, that's important for the public to hear. I think the implication for having a different BMI for the Asian American population are really several folds. One is in triggering an action for screening, so we can help to reduce undiagnosed rates of diabetes in the community. Two, really has an implication for treatment as well. If we're saying that people develop diabetes at a lower BMI, so many of the therapeutic options that are available that only gets activated or only are eligible for treatment above a certain BMI, now it just really introduces a new dialogue as for us to decide whether we should reimburse these therapeutic modalities at a lower BMI.